Welcome to India TV. You're watching Health DNA. I'm Anshu Jaising, and today on World Asthma Day, we are joined by Dr. Vikas Maurya. He's Director Pulmonology Fortis Hospital Shalimar Bagh. Welcome, sir.
Thank you.
So, what is asthma?
Right. So, asthma basically is a non-communicable disease. It's a chronic disease, and basically what happens is that in this disease, it affects the breathing tubes, our airways of the lungs. So, you have swelling of the airways, you have narrowing of the airways, and there is increased production of the mucus, which leads to a lot of symptoms like cough, breathing difficulty, and wheezing and other symptoms, which we will discuss later. And if we talk about this, it affects so many people all over the world. In fact, in the last data, if we saw in the WHO, more than 262 millions are affected all over the world, and more than around 4.45 lakhs deaths happen all over the world. And India, it accounts for 13% of these asthma patients, and 40% of mortality happen in India. So this is asthma.
So, what are the signs and symptoms?
Okay, so when we talk about the symptoms, they are very, very typical. Asthma can affect children, they can affect adults, they can affect elderly, and the symptoms varies depending upon the which strata of the age it affects. But predominantly you have the symptoms which are like cough, you have breathing difficulty, chest tightness, wheezing, which we say whistling of the sound coming from the chest, and more nighttime symptoms. So symptom increases in the night, and there is a diurnal variation, means more in the night, less in the day, and more with the change of the season. So these are the typical asthma symptoms which we see, and this can be associated with the symptoms of nasal cavity as well.
Who are more vulnerable to asthma?
Okay, I think it's we all know that asthma affects all age groups. So even children are also vulnerable. Asthma is a predominantly what we say is a genetic disease, and also it affects other people as well, those who have do not have any genetic history. So the the risk factor, if we talk about the patients who have in their family history of asthma, so the children can get the asthma. Then again those who are exposed to high pollution, whether it's an internal pollution or external pollution. Internal pollution like the smoking, and then rapid urbanization is also causing increase in the asthma patients, and then exposure to dust, exposure to house dust mite, exposure to any other allergens can also triggers can also act as a risk factor for asthma. Then premature birth, low birth weight, obese children, they are also more prone for getting asthma.
So, how to diagnose asthma?
Right. So, asthma, as I said, you have typical symptoms. So, for diagnosis, these typical symptoms, when the patient tells to you, you can say, okay, yeah, this looks like an asthma. Like for example, there is a patient having cough more in the night, right? So, these are the clinical symptoms, and having breathing difficulty, chest tightness, and then symptoms comes with change of season, then it comes with exposure to cold, dust, or something like smoke. So these are typical symptoms which signifies that you are suffering from asthma, and then you go to the doctor and they examine you. When they examine your chest, they found yes, you are having certain bronchi or wheeze in the chest, and then they do certain tests like spirometry, and out of spirometry or maybe some peak expiratory flow meter test, they can diagnose yes, you are having an asthma.
So, what is the difference between allergies and asthma? How to differentiate between the two?
See, allergy, there is a general term, right? Allergies. I may be allergic to anyone, right? So that's not right. So you can have a skin allergy, you can have eye allergies, you can have nasal allergy, and you can have the respiratory allergy. And respiratory allergy can lead to asthma. So because asthma, as I said, it's predominantly basically a disease which get triggers by allergens. So that's why we also say, okay, it could be an allergic asthma. But we can have patients who are non-allergic also. So there is a variety called non-allergic asthma as well.
Correct.
So you have triggers like dust, you have pollens, you have trees, you have wood, you have fungal. So these all allergens can trigger asthma, apart from the change in season, cold, and all these things. So allergy is a broad terminology, and whereas asthma is, relates to your respiratory symptoms.
So, sir, as you just mentioned about respiratory system, so how it affects the body asthma? What are the effects of asthma?
See, predominantly asthma affects our respiratory system. It's a disease of the respiratory system. So when it affects the children, and if we do not diagnose at an appropriate age, what we have found that their growth is limited. We have even seen, there was a patient of 9-year-old came to my OPD, and he was just hardly 2.5 feet, and he was around 11-year-old. So it can even affect the growth of the child, apart from affecting the lungs, right? So apart from having a lot of symptoms, you're living a life with full of symptoms. You're not able to go to school. I'm talking for children, and school absentees. I mean, their growth is affected. And if we talk of adult, right? So again, apart from affecting the lungs, and if we do not control, they can also affect our other body system as well. Mentally you are not at peace, so you can have mental problem also. We have seen patients who are having a stress. They are having some psychiatric issues with asthma. Then they can have effect on your heart as well, because you're not having enough oxygen supply. So you're having your heart affected as well. Then it can even affect in the females, can affect your all other body organ as well, because you do not feel well. You do not, you may not be doing everything for the family, right? You may not be able to go to the job. So it affects the apart from affecting the patient, it affects the family and as well as the society as well.
So when should one person seek help, medical care?
See, first of all, it's very important that we should, for them, whenever the patient, feel certain symptoms, they should always, tell to the family, and the family, obviously the family will take them to the doctor. So those symptoms are very important. Then the patient should have, they are having symptoms of respiratory symptoms, chronic symptoms, and they're having, the diurnal variation, the seasonal variation of these symptoms. So then they definitely should go to the doctor and they should seek help. And then obviously the doctor will, after analyzing the patient, the symptoms and the chest examination and certain tests, as I said, spirometry, they diagnose an asthma.
So what is an asthma attack like?
Oh, I think asthma attack can be very, very horrible also. We have seen patients coming into the emergency with very low oxygen, having a very rapid breathing. So yes, asthma attacks can be mild, can be moderate, can be severe. Mild one where you're having an increase in symptoms, which you can even manage at home also by increasing your medications, your asthma medications. But when if it is a moderate to severe variety of exacerbation or attacks, you have to go to hospital. You have to seek the doctor help. And these symptoms pertains to, for example, increased cough, increased expectoration, increasing breathing difficulty, whistling sound coming from the chest. You're not able to sleep. So these signs suggest, these symptoms suggest that you are having an asthma attack, and then you should immediately seek the help. You should immediately go to the doctor, or maybe sometime you're having, as I said, we see some patient coming in a very, very bad shape with low oxygen. So you have to come to emergency then.
So if I ask you about whether asthma is curable or not, like is it curable?
See, first of all, it's very important that we should appropriately diagnose asthma. It should be asthma. Sometimes we not able to diagnose asthma, it's some other disease, we label it as asthma. We've seen a lot of that also. It's not curable, right? But it's treatable. If we see the natural history of disease, what happens is that its initial years, the disease is intermittent. Means you're having a problem, you take medication, and then maybe for 2-3 years you're not having any symptoms. You're living a very normal life. But then again, after 5 years, 6 years, as your age advances, you started again having symptoms. So that's a typical natural history of asthma. So I would say it's not curable, but it is definitely treatable.
So what are the preventive measures that one has to take?
Okay, so see, asthma, as I said, there is predominantly caused by triggers. So if we talk about, yes, if I am able to take, prevent those triggers, like contact. Sometimes I have some contact allergens. If I am getting triggers with that, so avoiding those contacts. Then I should be aware of my allergens. For example, if I know that if I am taking that food and I am having increased symptoms, so I would avoid that.
Correct.
Then avoidance of, for example, some people have more triggers they have with dust, with pollens, with with very cold substance, with cold food or cold water or cold air. So they should they should know the symptoms. And what happens, that typical asthmatic patient, they knows what triggers the asthma.
Correct.
So you should avoid those things. Then you should avoid smoking. Then in house also, parents should not smoke if child is asthma. So very, very important. Then again, other aspects, how do you prevent? Take medications regularly.
So
you
what are
prevent
the
attacks.
medications and treatments available?
Inhaled steroids and inhaled bronchodilators. These are the mainstay of therapy in asthma, and they should be taken by all patients. Whatever the people say, there are a lot of myths, but we should stick to what the doctor is prescribing to us. What the specialist doctor is prescribing to us. So these are the mainstay of therapy in asthma.
So that's how we need to manage
Yeah,
it.
that's how we should manage it. And then vaccines.
Okay.
That's what I'm saying. Vaccines not only prevents your asthma attacks. Like children should get all vaccinated, all type of vaccines, flu, pneumonia, diphtheria, tetanus, whatever vaccine they need at particular age, they should get vaccinated. Similarly, elderly adult also, they should get vaccinated with vaccines. This prevents attack, and also this improves your asthma stability. And asthma education empowers asthmatics. They can understand their asthma. They can treat even the milder form of the attacks at home, and they know what type of medication can be taken. So education is very, very important, and also it empowers in preventing their exacerbations, their attacks, and they can live a very beautiful life which the God has given to us. So that is what my message on this World Asthma Day is, that we should educate people, we should educate asthma, and we should give them proper medication so that they can live a very good life. Thank you.
Thank you so much, sir, for joining us. It was a pleasure talking to you. Thank you so much.